Now, if you pick a stress test, what is the stress test that you should always pick as first line? Exercise EKG, period. That should always be your answer. The exam is always going to try to force you to pick that answer. In order for you to do an exercise EKG, what should the patient be able to do?
Walking.
You should be able to exercise and your EKG should be readable. What will make your EKG not readable?
Left bundle.
If the patient's got a pre-existing left bundle branch block, what else?
A test.
If the patient's got a pacemaker, what else?
On beta block.
No.
You can stop.
You can stop the beta blocker and then you can do it. Pre-existent,
LV.
yes, LVH with early repolarization changes. Great, what else?
Already.
Already ST segment changes are present. Okay, 4. What else? What if somebody's on digoxin? Digoxin, because it actually can cause ST segment depression. So if they tell you your patient's got digoxin, look for the EKG, you can have ST segment depression. So those are your 5 indications when you should not an exercise EKG because it's not going to be readable. Now when you exercise somebody, what's your target heart rate? 220 minus age, and then you want to hit how many percent of that? 85%. And when you hit 85%, what are you looking for on the EKG? ST segment elevation. No, I'm joking. You're not trying to cause somebody's MI and kill somebody here. You're looking for ST segment depression, okay? Never ST segment elevation. You're not trying to kill the person. You're trying to cause some ischemia, right? So what you're looking for is ST segment depression, not elevation. Now, whenever you do an exercise EKG, why is it so good that you do actual physical exercise? Why is it important? It tells you how physically fit the patient is.
Yeah.
What's the patient's cardiac health? Another important thing, the moment your stress test is done, the next 1 minute after you stop exercise, is that going to tell you some important information? Yes, it is. What is that information?
Return of heart rate.
Return of the heart rate from the peak. You should drop by at least 12 to 18 points within a minute. If it does, that tells you your patient's cardiac health is good. If your heart rate is still staying high, that tells you the patient's heart is bad. Okay? So always try to pick exercise EKG first.